Hi. I'm robo-Suzie and today I'll talk to you about thrombosed hemorrhoids, treatment options to stop the pain. Also don't forget to check out the link below, for the most comprehensive, multifaceted program for fixing hemorrhoids. It has a very high success rate. But back to our topic. Hemorrhoids are annoying and agonizing. If hemorrhoids are not taken care of or if they are misdiagnosed, the results can be tragic. Thankfully there is both natural and non-surgical options. Hospitals and family clinics can treat thrombosed hemorrhoids, but it is important to know there are treatment options you can perform at home. What are hemorrhoids? The condition under which the veins in your anal sphincter or anal area swell or become inflamed is called hemorrhoids. The cause might be pressure in the sphincter that damages the veins, and the bad habit of straining to defecate. What could also contribute to your hemorrhoids are long periods of the runs as well as bowel obstruction with hard feces. Hemorrhoids that show with hard lumps are thrombosed hemorrhoids. This type can be particularly painful and are usually found on the exterior of the anus. Signs of hemorrhoids. Discomfort and swelling around the sphincter is a typical symptom to be conscious of when trying to find the indications of hemorrhoids. Many individuals get the leading indications of hemorrhoids, but most of the time the symptoms will subside within few days. If you think that you have a hemorrhoid, it's very important to go and check with a doctor for a correct diagnosis, because some other more serious and often life-threatening disease present with similar symptoms as hemorrhoids. Diseases that have similar symptoms are anal fissures, anal abscesses, anal fistula, hematomas, anal cancer. The doctor will palpate your anal sphincter externally and may also perform an endoscopy to determine if you also have internal hemorrhoids. Additional tests for infection could be required if bursting or bleeding hemorrhoids happens. When diagnosed with hemorrhoids, the doctor will let you know the classification if it. Possible treatment options for thrombosed and external hemorrhoids. There is no one remedy for external hemorrhoid, but treatment regimens do exist that are exceptionally effective. Hemorrhoids that have just presented, new ones that have only been there for 2 or 3 days, and small ones are usually treated via non-invasive treatment options. The following are some of the common suggested treatment options: dietary changes, sitz baths, proper anal cleanliness, herbal supplements, topical creams and/or astringents. If you suffer from hemorrhoids, should keep stools soft by drinking enough liquid and maintaining a dietary program which incorporates high amounts of fiber. A hemorrhoids can may be aggravated by loose stools and diarrhea. Both hot baths and the application of cold compresses can help in healing of hemorrhoids, and both will help in relaxing veins. External hemorrhoid pain may be relieved by ointments and suppositories. Such procedures may act to keep your piles from developing further and getting more annoying. Thrombosed pile treatments could also include medical processes if the hemorrhoid is classified in one of the more severe categories. Elastic band ligation is the method used most often to address large hemorrhoids. This is done by applying elastic bands to a hemorrhoid, which cuts off the circulation. After this is completed, the hemorrhoid should pass with a bowel movement in 2 to 3 days. Your hemorrhoid could also be treated using one of the methods of cauterization. Infrared coagulation is the commonest non-surgical process used by practitioners here in the United States. Surgery can be employed to treat the most severe hemorrhoid cases. The kind of thrombosed hemorrhoids treatment a doctor or infirmary uses is dependent on the available options available to the doctor at the facility. Sclerotherapy shrivels the hemorrhoids by injecting hardening agents, which cause veins to harden. Oftentimes the largest and most severe hemorrhoids are customarily treated with a hemorrhoidectomy, which is a true procedure in which the bile is surgically removed from the area. Those who have undergone this operation most commonly suffer from post-procedural pain. Sometimes a patient will require 2 to 4 weeks before he or she can resume their normal everyday activities. Though thrombosed hemorrhoid treatments are numerous, the fact remains that natural remedies can be effective when dealing with a new case of hemorrhoids. You should usually get a doctor's permission before embarking on the path of natural treatment, to prevent damaging due to drug interactions. Swelling can be reduced and the affected area soothed with natural astringents. The following are commonly used: witch hazel, crane's bills, aloe vera, Using ice may help stop the swelling and discomfort due to hemorrhoids. Plant extracts of horse chestnut, bilberry, butcher's broom can help maintain the elasticity of capillary walls. A good and balanced diet not only help with the present hemorrhoids but also prevent the future ones. Other physical techniques could also turn out to be useful in reducing hemorrhoid pain. Hot baths can also be helpful. They can help ease your strained veins and lessen the discomfort. Wearing loose clothing and light underclothes may help the subject, as tight clothes can often add to the irritation and agony. Be sure to check with your healthcare provider about this and other medical advice and implications of your hemorrhoids. That's it. Thank you. Please subscribe, comment and like this video if it was helpful. See you soon.